Let's talk about size and location of the fibroids, because that's really important to decide further about your pregnancy. If your fibroids are small in size and they are not growing, then probably you are in the safer side. If I talk about location of the fibroids, if your fibroids are situated outside of the uterus wall and they are not interrupting in the growth of the fetus, then your baby is safe and your pregnancy would be safe. The real fact that fibroids usually grow in the first trimester, when your baby develops, your estrogen and progesterone hormones are on the peak, and that also help to grow the size of the fibroid. But usually it is seen that most of the time, once you enter into second and third trimester, your fibroids start shrinking. That's really a good news for you, and you do not need any kind of treatment. But if I talk about treatment, and if fibroids are growing, the first method to treat fibroids during your pregnancy is related to mild pain reliever, keep yourself hydrated, and bed rest. Those three things really helps you to relieve the pain of the fibroid. Bed rest help you to get relief from the pain. Hydration and changes in diet are really important factors. Citrus fruits really helps to shrink the size of the fibroids. So as soon you get to know that you have fibroids, I would recommend you to change your diet. Your obstetrician can also suggest you mild pain reliever if your fibroids are growing further. If I talk about second option, that is related to surgery. Your obstetrician or your radiologist will avoid to have surgery, because it can really lead to miscarriage and abortion further. If you have to go for surgery during your pregnancy time, first of all, your obstetrician will check that in which trimester you are. If you are in the 30th week of your pregnancy, then probably you are safe, though you may be having preterm delivery and your baby has to keep in the NICU. Your baby would be safe if you are going through the fibroid situation. Your obstetrician will suggest you to go for C-section only, and there is another method to remove the fibroid. Once you are done with the C-section, at that time only your obstetrician will do fibroid removal surgery process. What kind of surgery they are opting, it depends upon the size and location of the fibroids. This is the method usually your doctors will follow, because you already have an incision in your bikini area, and for fibroids also you have to go for surgery. So that's the best method. At the time of C-section, your obstetrician will remove fibroids also. If I talk about third method, which is really rare and your doctor will not opt for until it's really urgent, that is myomectomy. Myomectomy is a process through which your uterus can be preserved for future pregnancy, but during your pregnancy it is very risky, because most of the time maybe you have abortion or you have stillbirth. If you do not have any choice, then probably you have to opt for myomectomy. Those are the three methods which usually preferred during pregnancy time. If you find this information is useful for you, then please give me a thumbs up and subscribe my channel.